Okay, let's jump right into quite a complex topic today in veterinary health.
Sounds good.
We're doing a deep dive into a specific reproductive challenge, ovulatory failure in dogs and cats.
hmm
And guiding us, we're using excerpts from a veterinary text focused specifically on canine and feline ovulatory failure.
Right, that's our source material. And our mission really is to unpack what this means for pets.
Exactly. How it shows up, maybe why it happens according to this text,
Yeah.
how vets figure it out, and what the treatment options are based only on what's in these pages.
Right, so let's start right there. What exactly is ovulatory failure? What's gone wrong?
Well, the source basically defines it as the failure of the ovaries to release the oocytes, the eggs,
Okay.
from the follicles where they develop. And if that release doesn't happen, then the next step, forming the corpus luteum, that doesn't happen properly either.
And the corpus luteum, that's what makes progesterone.
Exactly. And progesterone is vital,
Yeah.
especially for maintaining pregnancy. So no ovulation, no proper corpus luteum, no progesterone surge. Got it. So it's the egg release and the hormonal consequence. How does it actually look in an animal?
The source says it can show up in a couple of main ways, pretty different ways, actually.
Oh.
One is sometimes called nymphomania. But in this context, it means the heat cycles are abnormal.
How so?
Either they happen too often, so the time between cycles is shorter than normal, or the animal seems to stay in heat for a really long time. That's linked to prolonged high estrogen.
Okay, so stuck in that heat phase.
Right. And the source points out this long exposure to estrogen can cause other problems, something's called estrogen toxicity.
Affecting other body systems.
Yeah, things like the skin or even the blood counts can get abnormal.
Wow. And the other way it presents?
The opposite, really. Prolonged anestrus,
Meaning.
meaning the animal just doesn't come into heat or the time between cycles is way too long.
So it's either too much cycling or basically none at all. That's quite a spectrum.
It is.
Who tends to get this? Any specific type of dog or cat?
The text says it affects intact females, so ones that aren't spayed of any age.
Any.
Any age. Although there is a note about a predisposition in older females. They seem to be more commonly affected.
Interesting. Does the source give any idea how common it is?
It does give one statistic. It mentions ovulatory failure is reported in about 1.2% of female dogs presented specifically for breeding management.
Okay, so in that specific group seeking help with breeding.
Right. Gives you a ballpark figure for that population.
What about breeds? Is there a breed link?
The text is quite specific here. It says there's no reported breed predisposition for the anovulation itself, the actual failure to ovulate.
Exactly.
But it does list some breeds where follicular cysts are seen more often, and these cysts can be a cause of ovulatory failure.
Ah, okay. So the underlying reason might be more common in some breeds, even if the failure itself isn't strictly breed-linked. Makes sense.
Exactly.
Which breeds are mentioned for the cysts?
Let's see. The source lists Malamute, German Shepherd, Golden Retriever, Bouvier de Flandre, and Labrador Retriever.
Okay.
And it also adds that we don't know if these cysts are hereditary. That's still an unknown.
Good clarification. Okay, let's shift to what an owner or vet might actually see. The signs.
Well, based on those two presentations we talked about, the signs vary. You might see that prolonged proestrus or estrus, the heat just lasting way too long.
Like, how long are we talking?
The source mentions it can go into 30 days, which is much longer than typical.
Right, and other signs during that.
The vulva might stay swollen, edematous. In dogs, that bloody vulvar discharge, the sanguineous discharge, might just keep going.
So the usual signs of heat just persist.
Persist, exactly. Or you see the nymphomania cycles too close together. Or the opposite, prolonged anestrus, no cycles.
We covered those. Any other visual clues?
Yes, particularly with that prolonged estrogen exposure, the text mentions bilaterally symmetrical alopecia.
Hair loss. What does it look like specifically?
The source describes it as hair loss that gets progressively worse. It's not itchy, non-pruritic, and it happens symmetrically, so on both sides of the body equally.
Ah, that pattern often points to hormones, doesn't it?
It really does. It's a potential external sign of that internal estrogen issue.
Okay. What about more serious signs?
Well, the text notes signs that might suggest something like a tumor is involved, an enlarged abdomen. Maybe you can even feel a mass in the belly, sort of cranial to mid-abdomen, and possibly ascites.
Fluid in the abdomen.
Yes, fluid buildup there.
That definitely sounds more worrying.
It is. And there's another category, too, if the cause is a chromosome abnormality.
What might you see then?
The physical signs can really vary. Genitalia might look underdeveloped or ambiguous or maybe normal, or sometimes an enlarged clitoris. Small body size is also mentioned, along with an estrus, a lack of cycles.
So a whole range of potential developmental differences.
Correct.
Okay, we've got a picture of what it looks like, who it affects. Now, the really interesting part, why? Why does this happen? What causes does the source point to?
It outlines several potential breakdown points in that whole hormonal cascade.
Like links in a chain.
Sort of. It can start right up in the brain. Either the hypothalamus doesn't release enough GnRH,
The starting signal.
right, or the pituitary gland doesn't release enough LH, the next signal down.
So the messages from head office aren't right.
Pretty much. Or maybe the messages are sent, but the follicle walls where the eggs are, their receptors don't respond properly to that LH signal.
So the message arrives, but nobody listens?
Essentially, yes.
Yeah.
Another possibility. The follicles themselves just don't make enough estrogen, and you need enough estrogen to trigger that big surge of GnRH and LH that causes ovulation.
Ah, so a failure within the ovary to send the right signal back up.
Exactly. It's a feedback loop, and it can break down at different points.
What else?
Functional follicular cysts are another big one. These are follicles that grow, make estrogen so that the animal shows signs of heat, but they just don't rupture. They don't ovulate.
So they act like they're working, but miss the final step.
Precisely. And the heat signs just continue. The source also lists immune-mediated oophoreitis.
Immune system attacking the ovaries.
Yes, inflammation caused by the body's own immune system.
Wow.
Then there are metabolic factors. Being in really poor body condition, cachexia, or the opposite, obesity.
Body condition matters that much.
Apparently so.
Yeah.
Stress is also listed as a potential risk factor.
What kind of stress?
Things like performance stress, travel, kennel stress, basically significant environmental or psychological stress.
Yeah.
And finally, other underlying endocrine diseases are mentioned, like Addison's disease or Cushing's disease. They can disrupt the reproductive cycle too.
Goodness. It's quite a list. Brain signals, ovary response, cysts, immune system, body condition, stress, other diseases. It really highlights how interconnected everything is.
It absolutely does, a complex system.
So with all these potential causes and varied signs, how do veterinarians actually pin down ovulatory failure? What's the diagnostic approach described in the source?
Well, it usually starts with thinking about what else it could be, ruling out other conditions. The source calls these differential diagnoses.
Things that look similar.
Exactly. For instance, sometimes an animal just has a naturally prolonged proestrus or estrus that will eventually resolve. The source notes these can last up to 30 days.
So sometimes it's just waiting to see.
To some extent, yes. Another one is called a split heat.
Split heat?
Yeah, the source describes it as basically an anovulatory cycle, no egg released, followed pretty soon after, like 1 to 8 weeks later, by a normal fertile cycle, like a practice run.
Huh. Interesting. Okay, what else needs ruling out?
Hypoluteoidism. Now, this is different because ovulation does occur, but the corpus luteum formed afterwards doesn't produce enough progesterone.
So a different kind of failure after ovulation.
Correct. Ovarian tumors are also on the list, like granulosa cell tumors or serous cystinomas. Remember we talked about potential masses?
Right, the enlarged abdomen or ovary findings.
Yeah, those need to be considered. Ovarian senescence, just aging ovaries, is another possibility.
Makes sense.
Immune-mediated oophoreitis, which we mentioned as a cause, is also a differential diagnosis. And those chromosomal abnormalities, the intersex conditions. The source notes that with those, follicles might develop, but then just regress, or sometimes they might even ovulate, so it can be complex.
Okay. Anything else?
One more important one, exposure to outside sources of estrogen.
Like medications?
Medications or even some topical creams people use could potentially be absorbed by the pet and cause signs that mimic prolonged heat.
Good point. Always consider external factors. So that's a lot to rule out. What about specific tests? Lab work?
Lab work is key. Your standard blood counts, biochemistry, urinalysis, those can help look for signs of that estrogen toxicity if suspected.
Like the anemia or low platelets you mentioned.
Exactly. But the real cornerstone test for diagnosing ovulatory failure itself, according to this source, involves progesterone levels.
Okay, how's that work?
It's crucial. You need to measure progesterone repeatedly, multiple samples, after vaginal cytology confirms the animal is in that peak estrogen phase.
Vaginal cytology. Looking at cells from the vagina.
Yes, under a microscope, when you see a high percentage, like over 70%, of what are called enucleated superficial cells, that's a sign of high estrogen. The body should be ovulating or just about to.
Okay.
And the diagnostic finding for ovulatory failure is that despite that high estrogen signal from cytology, the progesterone level consistently stays low.
How low?
The source says generally below 4 to 10 nanograms per milliliter. It often just kind of hovers around 3 to 5. And critically, it never gets above 10 or 12.
Ah, I see. So the cytology says go, but the progesterone says nope, nothing happened. That combination confirms it.
That's the key diagnostic confirmation described.
Yeah.
And if a chromosome issue is suspected based on the physical signs, then karyotyping, looking at the chromosomes themselves, is recommended.
Makes sense. What about imaging? X-rays, ultrasound?
Imaging is definitely helpful. Regular X-rays, radiology, can give you a general look. You might see a large ovarian mass if one's present, causing that enlarged abdomen. Or if there's ascites, that fluid, it gives a ground glass look, loss of detail.
But ultrasound gets a closer look at the ovaries themselves, right?
Oh, absolutely.
No.
Ultrasound is described as really valuable for evaluating the actual ovarian structures.
What can it show?
Well, the source explains different findings. Multiple small, black, fluid-filled circles, anechoic structures, are usually normal follicles.
Okay.
If those structures get bigger, say over 1 centimeter, they're considered cystic. If the whole ovary looks enlarged, that might raise suspicion for neoplasia, a tumor.
I see.
And sometimes you might see these anechoic structures, but their walls look thickened. That could suggest they're trying, but maybe failing, to turn into a corpus luteum, what's called partial or complete luteinization.
So the ultrasound gives real-time clues about what the ovary is or isn't doing.
It really does. And the source stresses that to actually document ovulation, you often need serial ultrasound exams, like daily.
Daily? Wow.
Yeah, to catch that moment when follicles might collapse and change structure.
Yeah.
They also mention using color Doppler.
To see blood flow.
Exactly.
Yeah.
You typically see increased blood flow around active follicles and much less around luteal structures after ovulation.
So it's really like watching a movie over several days, not just a single snapshot.
That's a great way to put it, to see if the main event, ovulation, actually happens.
Okay. Any other diagnostic procedures mentioned?
Yes. The text mentions exploratory laparotomy.
Going in surgically.
Right. Opening the abdomen to directly look at the ovaries, maybe take biopsies. There's a specific detail mentioned, too.
What's that?
That the ovarian bursa, the little sac around the ovary, actually has to be opened surgically to get a good look at the ovary itself.
Good anatomical point. Okay, that's a thorough diagnostic journey history, ruling things out, lab tests, imaging, maybe even surgery. So once you have the diagnosis, what about treatment? What does the source suggest?
The main treatment approach discussed is using medications to try and induce ovulation, to trigger it.
Trying to make it happen when it's not happening naturally.
Exactly. The goal is to give the hormonal push once cytology shows peak estrogen and ultrasound shows the follicles are mature enough.
Ah, there's a size requirement.
Yes. The source gives guidelines based on the animal size. For dogs, over 4 to 5 millimeters in toy small braids, 5-7 millimeters in medium large, 7-10 millimeters in giants. For cats, it's 2-3 millimeters.
So you need the timing right hormonally and the follicles ready physically.
Correct. Then you use specific hormonal agents.
Like what?
GnRH is one, that brain hormone. It can be given as an injection.
How often?
Dosages vary, but for dogs, it might be repeated daily for 1 to 3 days. For cats, often just a single dose is enough.
Okay. What else?
HCG, human chorionic gonadotropin, is another option, also an injection.
Similar protocol.
Similar idea, specific doses for dogs and cats, and this one might be repeated in 2 or 3 days if ovulation doesn't seem to happen after the first dose.
Can you use both?
Interestingly, yes. The source notes that GnRH and HCG may be given concurrently, together.
Any non-injection options?
Yes, there's a deslorelin implant mentioned. Ovulplant, the 2.1 milligram one.
How does that work?
It's placed usually in the vulvar lip mucosa, using a local anesthetic block.
And it just stays there?
No, this is important. The source says it's removed once ovulation is confirmed.
Ah, so it provides the stimulus, then you take it out. How do you know ovulation happened with the implant?
By checking progesterone. Once progesterone levels are documented above 10 ng/ml, that indicates ovulation, and the implant is removed, again using a similar block and dissection.
I see. Anything specific for cats?
Yes. For queens, The source mentions that cervical stimulation can be used as an adjunct.
How?
It can be performed starting when the induction medication is given and then repeated several times a day for 24 to 48 hours. It helps mimic natural mating stimulus.
Okay, so quite specific medical interventions to try and jumpstart ovulation. What about after treatment? Is follow-up needed?
Oh, yes, definitely. Follow-up is crucial, especially if the goal was pregnancy.
What's that?
The source warns that luteal failure, or hypoluteoidism, remember, where the corpus luteum doesn't produce enough progesterone, is actually more common after you've induced ovulation medically.
Ah, so you solve the ovulation problem, but you might create a progesterone problem later in pregnancy.
That's the potential risk highlighted. So monitoring progesterone during the potential pregnancy is important.
Makes sense.
And even if pregnancy isn't the goal, progesterone should still be monitored after giving the induction meds, just to confirm that ovulation actually occurred, that you saw that normal progesterone rise.
Confirming the treatment worked.
Exactly. And again, serial ultrasound can be used here too, perhaps with color Doppler, to visually document that ovulation happened post-treatment.
So ultrasound is really useful both for diagnosis and monitoring treatment success.
It seems to be a key tool throughout the whole process described in this source.
Well, this has been quite the journey through a complex topic. We've really unpacked ovulatory failure based on this text, from the basic mechanism of failed egg release
And the lack of progesterone.
to the very different ways it can present: too much cycling, no cycling.
Who it affects, especially older, intact females.
The range of signs, including things like hair loss or even abdominal changes.
And the really diverse potential causes brain signals, ovary issues, cysts, immune problems, stress, other diseases.
Then we walked through that detailed diagnostic process, ruling things out, the crucial role of progesterone testing alongside cytology.
The insights from ultrasound, maybe even surgery.
And finally, the specific medical options for inducing ovulation and the vital importance of follow-up monitoring.
It really paints a picture of how intricate reproductive physiology is. So many pieces have to align perfectly for a normal cycle.
Absolutely. And a breakdown anywhere along the line can lead to these issues. Understanding this deep dive, I think, really gives insight into why vets might need to run various tests and how complex diagnosing and managing these conditions can be.
It truly underscores the complexity of biology. A disruption at the hormonal level can ripple outwards and cause noticeable physical signs.
So maybe a final thought for everyone listening, based on all this: just consider how many almost invisible steps are involved in releasing a single egg.
The signals, the receptors, the feedback loops.
Even things like stress or body weight playing a role, and how a failure in just one of those tiny steps can manifest in such varied ways: prolonged heat, no heat, skin changes.
That's a powerful reminder of just how interconnected and, frankly, how delicate these biological systems are within our pets. Really makes you appreciate the complexity of life.